Hi, I'm Cassie Nesper, curator of the Melnick Medical Museum at Youngstown State University. Today I wanted to tell you about the bleeding instruments we have here at the museum. For hundreds of years before germs were discovered, physicians believed that one's health was a balance of 4 humors in your body: blood, phlegm, and 2 types of bile, black and yellow. Therefore, if someone was sick, their humors were out of balance. To restore balance, physicians had a number of different ways to increase or speed up the body's natural processes. They could purge you using different herbal remedies as emetics or diuretics. They could also intentionally raise blisters on your body to draw out the bad humors. This is a cupping set that would have been used for the purpose. The most common treatment, however, was bleeding. Because it was done for hundreds of years, it was a methodology. There were specific spots on the body to be bled for particular types of illnesses. There were also adjustments made for the frequency and quantity to be let depending on the severity of the illness. There were a number of different ways to bleed a patient depending on their illness. Most tools simply cut a vein. This fleam is from the late 1700s. It has 3 different size blades. The physician would choose a blade and set it on the patient's vein, and then use this wooden fleam stick to hit the back of the fleam. More compact versions of the fleam are these spring-loaded lancets. In these, the spring would drive the blade into the vein. This is a simple lancet, where the physician would provide the force to open the vein. These tools are very convenient to carry in a time when physicians visited patients at home and often had to travel miles on horse or on foot to reach their destination. This 4th item is a little bit different. It's a scarificator. This little metal box has 8 blades that pop out and cut the surface of a patient's skin, like cat scratches. This was another kind of bleeding used for specific types of illnesses. There were many instruments devised to let blood. Some physicians even used leeches. After the physician had caused the blood to flow, he would collect it in a bowl with measurement markings. Some of these could be decorative or simple, like this one. The markings on the side would let the physician know when the correct amount of blood had been let. In this time before the discovery of germs, physicians would simply wipe their tools off or rinse them under water and store them again for the next patient. Some doctors practiced bloodletting into the late 19th century. So there you have it, bloodletting tools. Be sure to check out our other videos on the Melnick Medical Museum YouTube channel.